breast implant revision surgery and its complexity. How is it different from your primary procedure, breast augmentation, or reconstructive surgery? One thing to say straight off the bat is that any revision surgery in any part of the body for any procedure is generally more complex and more technically challenging. And the same is true for breast implant revision surgery. You're going into an already operated space, there's already scar tissue there, the body's changed over some time when the implants have been inside you, and the implants themselves may have changed position or have degraded to some extent or ruptured or what have you. So it creates additional challenges and requires significantly more expertise and skill to get a reasonable outcome. It is really important to have good and reasonable expectations prior to this procedure. It is not the same as operating in a primary setting. Like I said, achieving a good outcome is much more challenging. So I think we have to reset our expectations. We need to try and get you to a good spot with the hand that we've been dealt with, whatever the complications may be at that time, and see how we can achieve that. That may involve addressing the implants themselves, removing them, changing the position of the implants, for instance, creating a new pocket, tightening the pocket, lifting the breast around it, perhaps in some cases as well, upsizing breast implant if that's the way you want to go. So there's a number of things to consider, but it is important to remember that expectation management is something that your surgeon will be very much concerned about, because we know that this secondary procedure, secondary surgery is definitely a step above your primary procedure. So being prepared, really doing your homework before actually going ahead with this procedure, going to see an experienced surgeon who's dealt with a lot of revision cases, reconstructive cases, is really what's going to help you in this scenario.